In today's class, we'll be learning about pathophysiology of circulatory shock, heart failure, syncope, hypertension, hypotension. If time permits, I will discuss all of these applied aspects. I will be starting with shock. In general, by the term shock, we mean suppression or depression of body functions produced by any disorder. This is the common term of shock, common meaning of shock. But meaning of circulatory shock is more precise. Circulatory shock, it refers to shock developed by inadequate blood flow, inadequate perfusion of the body organs throughout the body, resulting in when inadequate blood supply is made to the different organs, what is the consequence? The body feels there is hypoxia, lack of oxygen. Less supply of blood means less supply of oxygen will be there. So tissues will feel hypoxia. And because of hypoxia, lot of disturbance will be made. Tissue functions will be deranged. There will be shifting. Usually tissues tries to develop its energy from the anaerobic oxidations. But when there is hypocirculation, less supply of blood to the organs, body will shift its oxidative process from aerobic to anaerobic. As a result, what will be there? There will be production of lactic acid. And this lactic acid will cause acidosis, lactic acid acidosis. And because of these, the cells, if it is not treated, not taken care of, then what will happen? Because of this acidosis, the cells will die. First, the organelles will be destroyed, mitochondria will be destroyed, cell membrane will be destroyed. Okay, so the cell will die. And this will not happen only in one organ. It may happen in multiple organs of the body. So it will lead to multi-organ failure. Moreover, when the cells die, there will be sepsis. And because of sepsis, there will be production of, in the cell, there will be production of interleukin. And these interleukins are vasodilators. And as a result, what will happen? Lot of vasodilation will be there and tissues will be perfused less. Other tissues will be perfused less. As a result, what will be? The condition is life-threatening and the person may die because of multi-organ failure. For this reason, circulatory shock is very life-threatening condition. So it has to be taken care of at the beginning. There are 4 types of circulatory shock. One is hypovolemic shock. Means, suppose there is hemorrhage, we have 5 liters, 6 liters of blood, and because of hemorrhage, we will be losing lot of blood. As a result, blood volume will be reduced. And because of this reduced blood volume, there will be a shock. This sort of shock is called hypovolemic shock. And this hypovolemic shock, well, how we can identify this hypovolemic shock? Before I So because of there is lack of or decreased oxygen, decreased quantity of blood, so less blood will be going to the organs. So organ will feel hypoxic, and because of hypoxia, shifting of aerobic to anaerobic manner, production of lactic acid, acidosis, and ultimately tissue cells will be dying, as I said. So how can we diagnose, or what are the symptoms of this sort of hypovolemic shock? There will be tachycardia, thin and thready pulse, decreased cardiac output, increased respiratory rate, and low BP. Obviously, there will be low BP, pale and cold extremities. Extremities will be pale since less blood is coming to the extremities, and there will be coldness in the periphery or in the skin, wherever it is, in the extremities or in the abdomen, in the body surface. And there will be lethargy, restlessness, confusion, finally death. Another type of circulatory shock is vasodilatory shock. It is also called vasogenic shock. There will be massive vasodilation. Because of this vasodilation, the vital organs will not be getting proper amount of blood. And not only this, there will be excess formation of ECF, extracellular fluid. Why? Because of dilatation, there will be what? The capillary exchange will be increased, and the extracellular fluid formation will be increased, and so ultimately in the circulating volume will be decreased. Okay, so this sort of neurogenic or vasodilatory shock is seen in case of fear. When you fear, suddenly you saw a lot of blood. So this is a shock to you. So because of this, there is a massive vasodilation occurs. So what happens? Less blood will be coming to the cerebrum, so the brain. So there will be fainting. Okay. So in the capillary, there will be a lot of the capillary exchange. In the endothelium, there will be permeability will be increased. So a lot of fluid will be coming out of blood vessels into ECF. So blood volume will be decreased. So ultimately, what is it? The volume is decreased. And it may happen, vasodilatory shock, it may happen in other situations, like when anesthesia is given, like emotional distress, as I said, vasovagal attack. It is an emotional condition. It is an emotional condition. What happens in vasovagal attack? Cerebral cortex, this emotion is developed in the brain, cerebral cortex. So in this condition, cerebral cortex stimulates the hypothalamus. Hypothalamus stimulates medulla. Now what happens in medulla? Medulla is having vasomotor center. Okay, one is cardio inhibitory center, means parasympathetic center, another is sympathetic center. Now what happens? Because of this, the parasympathetic center gets stimulated and sympathetic center gets inhibited. As a result, what happens? Sympathetic center is, since it is inhibited, its control over the blood vessel is withdrawn. As a result, blood vessels become dilated. So more blood is accumulated now in the blood vessels. Okay, and what happens? The vagal stimulation, it will cause, it is parasympathetic in nature, and it will affect the heart. How it will affect? It will release acetylcholine. And we know acetylcholine is inhibitory in action, means cardiac activity will be, heart rate will be reduced. So there is what? Vasodilatation. At the same time, there is bradycardia. Consequence is what? Less cardiac output. Less cardiac output. So less amount of blood will be going to the organs. So the organs will face hypoxia, As a result, again shifting of oxidation from aerobic to anaerobic, lactic acid synthesis and lactic acidosis, damage of the cells. Circulatory shock are 4 types, as I said. One is hypovolemic shock, and this hypovolemic blood volume becomes reduced. Why blood volume becomes reduced? Because of hemorrhage, because of trauma, surgery, surgical shock, burn. Lot of fluid is lost in burning, and dehydration shock. If there is dysentery, vomiting, repeated vomiting, so there will be huge loss of fluid. So what will happen? What will happen? Tissue fluid is reduced. So now tissue fluid has to be maintained. So from blood, plasma, from plasma some fluid is shifted to the tissues. As a result, blood volume is reduced. Okay. So this will cause hypovolemic shock. These are the incidents of hypovolemic shock. Another type of shock is vasogenic shock. Here, neurogenic shock, anaphylactic shock. In anaphylactic shock means allergic shock. So what happens when somebody is suffering from anaphylactic shock? Their body is swelling. Body swelling is there. Means what? In the capillary, permeability is increased. Lot of fluid is coming into the ECF. As a result, swelling is there. Okay, edema is there. Formation of edema at the cost of the blood volume. At the cost, so blood volume is reduced. So its output to the organ is reduced. Okay, this way vasovagal shock is produced. Anaphylactic septic shock. Septic shock, this bacteria, they produce some interleukins. They are vasodilator. These interleukins are having vasodilating effect. So lot of vasodilation will be there. So edema will be there, blood volume will be reduced. Okay. And cardiogenic shock. Cardiogenic shock, see, first one is arrhythmia. In some arrhythmia, what happens? Irregularity in beating. Sometimes it happens, the atria, there is first SA node produces a lot of impulses. But all these impulses are not coming to the AV node. As a result, atrial fibrillation is there, but less number of stimulation will be coming to the ventricle. Through it will be able to pass to the AV node and will be able to come to the ventricles. As a result, atrium will be contracting repeatedly, but ventricle is not contracting at the rate. As a result, what is happened? Cardiac output will be hampered. Proper cardiac output would not be there. So, arrhythmia, ventricular arrhythmia, auricular arrhythmia, that can result in cardiogenic shock. Cardiogenic shock, it means the shock is due to heart, abnormality in the heart. So, arrhythmia, it is the abnormality of the heart. So, this arrhythmia, suppose in another case, we know cardiac output is equal to heart rate into stroke volume. Now, the stroke volume depends on 3 factors. Health of the myocardium, means intrinsic health of the myocardium, and preload, and it is afterload. All is in heart, involving heart. What is preload? What is preload and afterload? During diastole, what happens? Blood enters in ventricles. Okay? So, ventricle is filled up. So, maximally filled up. Now, it is called end diastolic volume, EDV. Okay? So now no more blood is entering. So it is the end diastolic volume. Now according to Starling law, Frank Starling law, we know more the distension, more will be the length of the cardiac muscle. Since it is distended, so length of the cardiac muscle is also extended. So more extension of cardiac muscle length, more will be the force of contraction. Okay, so this is important. So more the force of contraction, more will be the stroke volume. So this is called preload. Preload means load before contraction, before systole. So how much will be the stroke volume? That will depend on what is the preload. How much blood has entered into the ventricle. So what is the preload? So if the preload is more, then what will happen? Length will be more, muscle length will be more, force of contraction will be more, stroke volume will be more, cardiac output will be more. Okay, so it depends on, cardiac output depends on preload. And if preload is there, and what is afterload? What is afterload? This is the heart, and some amount of preload. The heart has taken the preload, means some amount of blood had entered within the ventricle, some amount, that's the end diastolic volume. So this is the volume, preload. Now what the ventricle will do with this? The ventricle will eject this into the circulation. If the path is clear, it is very easy to contract it and send it to the circulation. If the path is already congested, lot of resistance is there, what will happen? To overcome this resistance, the heart has to contract with more force. If there was no obstruction, suppose from here you want to go out, but lot of people are there outside. So you cannot go outside easily. You have to, then after the door, if you want to go outside, then what you have to do? You have to apply more force. Isn't it? That is called afterload. So afterload is created by the peripheral resistance. If more peripheral resistance, heart has to work more. If less peripheral resistance, heart has to work less. So in case of increased peripheral resistance, the heart muscles has to work much more. Then it has got some capacity. How much it can do, how much it can increase. So there is a limitation. So beyond that limit, it cannot eject all the blood into the circulation. As a result, what happens? If preload is more, it cannot eject all the blood, because it has to generate, if it has to eject all the blood, it has to generate huge pressure to overcome that resistance. But it becomes, so usually how your heart muscle is efficient, it is determined by ejection fraction. What is ejection fraction? Ejection fraction is stroke volume divided by end diastolic volume. Suppose at the end diastole, how much blood is accumulated? Before systole, how much accumulated? Say 120 ml. So this is the ventricle. So it has accumulated 120 ml. So now during systole, it will contract. Will it be able to eject all the blood? Okay, how much it has ejected? We know stroke volume is 70. Stroke volume is 70. Suppose this ventricle 70 ml it has ejected. So it is 70 and EDB is 120. Now divide it and multiply it by 100. How much it comes? Okay, let it be 60. Now it is easy. 50%. Now it is 50%. Now see, if the peripheral resistance is more, so it will not be able to eject 70 ml of 60 ml, it will be much less. So if it is 40, what is the ejection fraction? Less. Less the ejection fraction means less the efficient is your cardiac muscle. More the ejection fraction, normally ejection fraction means more the ejection fraction, more is the efficiency of the cardiac muscle. More the strength it can produce. Okay, so now see, if peripheral resistance is more, then what will happen? Stroke volume will be less. Stroke volume will be less. Ejections will be less. And what will happen to cardiac output? Stroke volume is less. So if you multiply it, the product will be less, cardiac output will be less. So this way, here. So this way, cardiac activity, because of cardiac activity, there problem in the heart, there can be less cardiac output, and because of this, the body tissues can be perfused less. Okay. Now another thing is shock due to ischemia. Ischemia, what is ischemia? Narrowing of the blood vessel. Which blood vessel? Coronary circulation, coronary blood vessels. If blood vessels are narrowed, so less oxygen will be coming to the cardiac muscles. Now it will get less, it will produce less energy. So since there is production of less energy, it will not be able to contract efficiently. So cardiac output will be less. So ischemia is another condition in which cardiac output is reduced. And heart failure. We will discuss after this the heart failure. What is the heart failure? Heart failure means, heart failure is, again, it is the perfusion, it is the cardiac output, it is the supply of blood by the heart to the tissues according to the requirement of the body. Requirement of the tissues. If the tissue requirement is say X amount, but I cannot supply that amount, the heart cannot supply those amount, then it is termed as cardiac failure. Cardiac failure means it is, when it is seen, it is unable to supply blood, unable to maintain blood supply to the tissues as per its requirement of the tissues. Okay, when the requirement is more, supply is less, then it is called heart failure, cardiac failure. So here also we can see the heart cannot, in cardiac failure, heart cannot supply blood, supply oxygen, supply nutrients to the tissues according to its demand. So this is the condition, this condition is called heart failure or cardiac failure. In arrhythmia, See, in arrhythmia, what happens? It is affected. Heart rate, see. We know normally cardiac cycle length is 0.8 second. Out of this, 0.3 second is for ventricular systole and 0.5 second is for diastole. So diastolic time is 0.5 second, systolic time is 0.3 second. When heart rate will be increased, this will be shortened. Now this will be reduced, this time is also reduced, but the problem is, this is not reduced so much. Maximal reduction happens in this case. So during diastole, what happens? Filling occurs. So if this time is reduced, there will be less filling of ventricle. So if the ventricle gets less blood because of shortage of time, it will be ejecting less blood. Means cardiac output will be reduced. When heart rate is increased too much, cardiac output will not be increased. Rather, it will be reduced. So in that case, the heart will be unable to supply the required amount of oxygen to the tissues, required amount of blood to the tissues. Obstructive blood flow to the tissues. There will be some obstruction. One obstruction may be in the myocardium because of tumor. The outflow, if the tumor is at the outflow, at the root of the aorta, then what will happen? Where the blood cannot enter into the aorta, so there will be reduced blood flow. There will be reduced cardiac output. So according to the requirement of the body, heart cannot supply it. Similarly, shock due to cardiac tamponade. What is cardiac tamponade? Accumulation of blood in the pericardium. Ventricle expands. Okay? So at the outside of the ventricle, what is this? Pericardium. If the pericardium, normally there is thin layer of fluid, pericardial fluid. Now if it is filled up with blood because of injury from external, there may be accumulation of blood in the pericardium. And because of blood in the pericardium, the ventricle cannot expand. So this is an expansion. During it cannot expand, ventricle cannot expand, cannot go relaxation fully. Because where to go? There it is occupied by the fluid, by the blood. As a result, the ventricles cannot be distended properly. So less blood will be, end diastolic volume will be less, and cardiac output will also be less. Shock due to pulmonary vascular obstruction. Okay. Pulmonary vascular obstruction. The ventricles, right ventricle, it has to send its blood to the lung. If there is obstruction in the lung, less blood will be coming into the lung, and from the lung, less blood will be coming to the left ventricle, left atrium, left ventricle. Since less blood is coming from lung to the ventricles, so ventricle will also eject less blood to the circulation. So hypovolume. So there is less cardiac output. So this will be called shock. Let us now discuss about pathophysiology. What is the pathophysiology? The trigger. Why the shock? What to initiate shock? So it may be hemorrhage, it may be myocardial infarction. Why? What is the relation between myocardial infarction and shock? Myocardial, suppose these are the wall of the ventricle. These walls are the wall of the ventricle. Now, this part of the ventricle is infarcted. Now, this area is unable to contract. other part will be able to contract. So since less force will be generated, less cardiac output will be there. So myocardial infarction also causes. Not only this, in myocardial infarction, cardiac heart rate is also increased. Because of increase in heart rate, we have seen if heart rate is increased too much, cardiac output is also reduced. Okay? So hemorrhage, myocardial infarction, sepsis. Septic, there will be liberation of interleukin, there will be vasodilating, and obstruction of outflow. As a result, what will be? Effective circulating blood volume, that is cardiac output will be reduced. Okay? Is that right? So because of this, cardiac output will be reduced. And since cardiac output is reduced, tissue perfusion will be reduced. There will be hypoperfusion. Now, if there is hypoperfusion, tissues will get less oxygen. Now, if tissue gets less oxygen, there will be anaerobic metabolism. There will be shifting. As I said, less oxygen. So it cannot use aerobic path. So it has to depend on anaerobic path. As a result, what will happen? Lactic acid will be produced. So now this lactic acid will cause lactic acidosis. Cellular, because of this lactic acidosis, another step is there, it will be lactic acidosis. Because of this lactic acidosis, cellular dysfunction and energy failure, the cell will not get adequate amount of thing. There will be less production of ATP. Okay, and because of less production of ATP, sodium potassium pump will not act. For sodium potassium pump, it needs energy, it needs ATP, it will not act. So ionic balance will not be maintained, and not only the mitochondria will dysfunction, mitochondria will be damaged, cell membrane will be damaged, the cell will die. The cell will die. At the same time, because of death of the cell, there will be inflammation, and because of inflammation, there will be secretion of cytokines. These are vasodilators, strong vasodilators. Capillary leakage will be there because capillary permeability will be increased. As a result, the tissues will be, there will be hypoperfusion and there will be hypotension. Because of dilatation, there will be hypotension. And as a result, there will be multi-organ failure and ultimately death. So because of death, if it is not taken care of at the initial level, then it happens in ICUs. Okay, after 7 days, 8 days, they are declared there is septicemia, multi-organ failure, that means the patient is going to die. When there will be sepsis, no, there is no chance. When there is multi-organ failure, that means the patient is going to die. Four types I have already told. And the treatment. What is the treatment? Blood transfusion. When hypovolemia is there, blood volume is less, lot of blood is lost, so you have to transfuse blood. Plasma transfusion. In case of burn, lot of fluid will be going out. So the osmotic pressure is reduced. To maintain the osmotic pressure, you have to add the albumin. The albumin, to increase the albumin injection can be given, that will enhance osmotic pressure. As a result, the pressure will be maintained. Epinephrine in anaphylactic shock. In epinephrine, there is what? In anaphylactic shock, there is massive vasodilation. So if adrenal is given, that will cause vasoconstriction. So inflammation will be reduced. Those extra fluid that has gone to outside, that will be again re-entered into the vessel. So blood volume will be attained again. Dopamine in traumatic and cardiogenic shock. These are the treatment, but physiological treatment, it is not available for shock. Now let us discuss about cardiac failure. Shock is important for your exam. Circulatory, cardiac failure, heart failure, same. What is heart failure? As I said, heart loses the ability to pump sufficient amount of blood to all parts of the body to meet the metabolic demand. Okay, now your metabolic demand, according to your metabolic demand, blood is supplied to your organ. Now, if suddenly your metabolic demand has increased, but your heart is unable to supply those extra amount of oxygen, extra amount of blood to the tissues, then it is said that it is cardiac, there is cardiac failure. Got it? So this is cardiac failure. So based on time course, this cardiac failure can be divided into acute heart failure. It happens in myocardial infarction and also as chronic heart failure. This chronic heart failure, it develops slowly, takes a lot of time. But acute heart failure, it develops suddenly and aggressively. Suddenly as well as aggressively. As a result, what happens? Sudden rapid onset of signs and symptoms of abnormal heart functions. Its symptoms are very severe initially. However, after some period, some rest, again the condition is regained. So, it may require or may require treatment. But chronic heart failure, it is the heart failure that is characterized by symptoms that appear slowly over a period and become worse gradually. So, definitely this will require treatment management. And congestive heart failure. Congestive heart failure means congestive lung, congestive heart body, ventricle has to eject the blood. Where to eject? Into the blood vessels. If the blood vessels are already having lot of blood accumulated, then it is called congestion, like traffic congestion. It's a traffic congestion. Like the blood is congested in the blood vessels. They are not moving. They are not circulating. Okay. Similarly, in lung, there can be congestion. When there is lung congestion, there will be breathlessness, fast breathing, respiratory rate will be increased, shallow breathing, not deep breathing. Okay. Why? Because of congestion, the alveoli, normally outside the alveoli, there is only the lung tissue, there is no extracellular fluid. There is no extracellular fluid. There is a mechanism. If something is released, some amount is released, it is immediately absorbed. There is a mechanism in the lung. So normally it is not done. But because of congestion, there may be formation of extracellular fluid. Now this extracellular fluid will reduce the elasticity of the lung. As a result, lung tissues will face difficulty in expanding and it's contracting. Okay. Not only this, some fluid may enter within the alveolar space, within the alveoli. Okay. So, fluid may be accumulated in the periphery. In lower part of the body, in abdomen, ascites. So this, because of congestive heart failure, this may be seen. What are the causes? The causes mentioned here in uppercase, these are the most frequent causes, major causes, main causes. What is this? A coronary artery disease means it is developed coronary artery disease means it makes ischemia, it will develop infarction. So if ischemia develops, infarction develops, what is the consequence? We have seen. And arrhythmia, we have seen the result of arrhythmia, defective heart valves. Defective heart valves. See, Aortic valve. If there is defect, means there is the sclerosis, means the valves are heavier, and when it closes, opens, this gap remains. Okay, so when ventricle will contract, some amount of blood will be going out, and narrow space is less, so heart has to create more pressure to send this blood. Again, during diastole, some amount of blood that has been ejected, it will be coming back. Regurgitation will be there. So this extra blood, again it has to pump out. So because of this additional energy, additional work, the cardiac muscle has to do. Okay. So it may cause failure. Arrhythmia, I already told arrhythmia is another important factor. Cardiomyopathy. Cardiomyopathy is a very big-hearted man. It is always not true. Big-hearted is also pathologic heart. Means here the wall of the heart is very thin. It is called cardiomyopathy. As a result, thin wall means it will be able to, lot of blood is there, but it cannot eject the whole blood or part of the, only little portion of the blood it can eject into the circulation. Means its ejection fraction is very less, since its myocardium is very weak. Diabetes, another cause, congenital heart disease, perforation in the septum, that is also increase the workload of the heart and will cause heart failure. Diabetes, hyperthyroidism, increased heart rate. In hyperthyroidism, what is there is increased heart rate, blood vessels become thin, and there is reduced diastolic filling, reduced contractility, myocardial contractility. As a result, cardiac heart failure can be seen. Lung disorders, external compression, pericardial fluid. If the pericardium fluid is there because of pericarditis or for some other reasons, then heart will be unable to expand as it is as required, because this will be they will obstruct, they will create obstruction to expand. Pathophysiology, reduced cardiac output, there is neurohormonal activation, RAAS and SAS. What is RAAS? Renin, angiotensin, aldosterone system. What is its role? Renin is when renin is secreted from where? JZ apparatus. When it is secretes, when JZ cells secretes, when perfusion is become less, then the JZ cells secretes renin. Now this renin converts angiotensin 1, which is a plasma protein. Now this, because of action of the angiotensin 1, renin, angiotensin 1 will be converted into angiotensin 1, angiotensinogen to angiotensin. Now this angiotensin 1 along the blood, through the blood will come to the lung. In lung there is ACE, angiotensin converting enzyme. So this will convert angiotensin 1 into angiotensin 2. Now this angiotensin 2 is a strong vasoconstrictor. It will cause vasoconstriction. Okay. Now not only this, it also increases aldosterone secretion. Now when aldosterone is secreted, because of the angiotensin 2, aldosterone is secreted from adrenal cortex. Now what is the function of aldosterone? It absorbs sodium. See, sodium will not be absorbed alone, it will take water along with this. So there will be increased sodium retention and there will be increased water absorption. So this will be activated. Why? To increase the blood volume. This is a compensatory mechanism. To increase the blood, since blood is lost, more blood is required. So body will try to increase the blood volume. How? by activating the RAS system. So this will try to increase the blood volume through this system. And sympathetic nervous system. SNS means sympathetic nervous. What is the function of this sympathetic nervous system? It will increase the heart rate, cardiac output will be increased. It will also cause vasoconstriction. As a result, blood pressure will be increased. So, with this mechanism, it will try to compensate. Since cardiac output is reduced, so this mechanism will try to compensate it. But it cannot go on for long period. It will fade. Then, what will happen? Then there will be, so up to this, when it is able to maintain or compensate, then no sign symptoms will be developed. So as it when it fails to maintain this way, then what will sign symptoms of cardiac failure will be seen, can be seen. Eventually, as a ventricular remodeling eventually leads to volume overload and congestion. Volume overload means blood will be accumulated in the periphery within the blood vessels. They are unable to come to the ventricle. Since ventricle is unable to eject, so there will be traffic jam. Means there will be traffic jam in the periphery. There will be traffic jam in the lung. Okay, so that is, this traffic jam is due to cardiac failure. The same thing. Signs symptoms of cardiac failure. Signs symptoms of chronic heart failure. Chronic, we have seen chronic and acute. In chronic heart failure, what will be fatigue and weakness, rapid and irregular heartbeat, shortness of breathing, fluid retention and weight gain. Fluid will be retained in the body, there will be swelling, so weight gain, there will be weight gain. Exercise intolerance. Why exercise intolerance? Because already congestion in lung is there. Okay, so when you start to doing exercise, heart rate will be increased, cardiac output, stroke volume will be increased. Okay, so because of this, venous return will be increased. Venous return will be, now this venous, because of the increased venous return, it has to come to the left auricle, but here auricle is congested. Right ventricle is also congested. Why right ventricle? Lung is congested. As a result, what will be there? The person will be unable to continue exercise. Another is nausea, vomiting, cough, chest pain, orthopnea. What is orthopnea? In cardiac failure patient, you will find they cannot sleep. But when they are seated, they are comfortable. When they are seated, they are comfortable. But when they are sleeping, they are unnerved. They cannot lie down. Why? What happens? When they lie down, venous return increases. So, venous return increases means this venous blood will try to enter into the left atrium, right atrium, and right atrium blood will try to enter into the ventricle, but there is already congested. Ventricle is already dilated. Because heart failure, it is not unable to all the blood, only little amount of blood is empty. So as a result, what happens but when the person is seated, then venous return is reduced. Then he finds comfortable in that posture. So that is called orthopnea. Signs symptoms of acute heart failure. What is this? Signs symptoms of acute heart failure may be same as chronic heart failure, but the signs symptoms appear suddenly and with severity. Okay, but the other one in chronic stage it develops slowly and takes time. When heart starts to fail suddenly, the fluid accumulates in lung, causing pulmonary edema. Pulmonary edema means the fluid tissue, pulmonary extracellular, outside the alveoli there is edema, there is accumulation of fluid. There will be in interpleural space, in the interpleural fluid there will be fluid. It results in sudden and severe shortness of breath, cough with pink and foamy mucus. Heart palpitation occurs and it may lead to sudden death if not attended immediately. So it is the sign symptoms of acute heart failure. And types of heart failure, Systolic heart failure, there are different types. One is systolic heart failure, there are 4 different types. One systolic means during systole, failure means heart cannot perform its systolic function because of the congestion. Okay, it may happen in right ventricle, it may happen in left ventricle. If it is left ventricle, congestion is in lung. If it is right ventricle, congestion in periphery of your body. There will be swelling, everything. So in this way, diastolic heart failure. There is diastole. It cannot fully undergo diastole because of obstruction from outside. Obstruction from outside. So these are the causes of diastolic failure. Another right-sided heart failure, left-sided heart failure. Treatment. Lifestyle changes. This is important. Lifestyle changes. Low salt diet. You are taking more salt means blood osmotic pressure will be increased. More fluid will be accumulated, volume will be increased, blood volume will be increased. Okay, so that's why salt is not advisable. Fluid restriction. Already there is a lot of fluid in the body, so there should be fluid restriction, and exercise of low grade, exercise should be there. Treat the underlying causes. These are the pharmacological treatments, so it is not, you are not concerned now with this. Okay. So, I don't have time, otherwise I plan to, essential, I have to take another class. This is for hypertension. You learned what is this blood pressure, but you don't know what is hypertension, what are the different types of hypertension, what are the factors, what are the sign symptoms. So you have to learn this. This is very important, applied aspects. So and another important question from this is essential hypertension. And essential hypertension again is divided. One is benign hypertension, and another is initially it was there in the malignant hypertension. So this malignant hypertension is a common question in university exam, in any exam. So you try to know and learn this malignant hypertension also. Okay.